Hi, I'm Rachel Arthur and I'm a naturopath specialising in nutritional medicine. I practice in the Byron Bay region and I also teach at Southern Cross University. Okay, so what I'm talking here about today is talking about the role of nutrition in mental health. I'm a passionate advocate for nutrition as either an adjunctive therapy or a standalone treatment in mental health. There's a lot of science coming out that shows us that mental health isn't all simply about increasing or decreasing levels of certain neurotransmitters, that we have to make sure that the brain is equipped with the right nutrients, healthy amounts of nutrients, not excesses or deficiencies of anything, so that it can work properly. There's a lot of studies coming out showing that we can use nutrients to improve efficacy of different psychoactive sort of medications, and that's certainly something I've had a lot of experience with in clinical practice. So I'm just going to be talking about the idea that nutritional management of mental health comes at many different levels. We need to look at a basic foundational healthy diet. From there we look at actually assessing an individual to determine specific deficiencies and excesses and therefore correcting those. We look at addressing drug-nutrient interactions. Some of the psychiatric medications do have a negative impact on certain nutrients and we need to correct those, again, if we want to get full efficacy out of that drug. And then we also look in some instances at using nutrients in what I call supraphysiological levels. So this is above what is normally found in physiology, and that's to have a very specific effect on brain function and nervous system function. So they're all the different aspects that we're going to talk about briefly, and just really trying to get people to think about that nutrition isn't an alternative. It should actually be right in there, always thought about as a possible modality with any patient that presents with a mental health issue.
I'm Dr. Azita Moradi. I'm a consultant psychiatrist and a university lecturer based in Melbourne. I guess when it comes to area of mental health, one of the most important things to remember is that mental illnesses are very multifactorial and multifaceted illnesses, and they really should be approached as such. One of the most basic things that we learn in medicine is that every person who approaches us, we need to be looking at in a very holistic picture of why is this person presenting to us at this particular time with these particular symptoms and this particular presentation. And there are often many factors why people present at a particular time in a particular way, and that could be anything from their genetic vulnerability to physiological and physical factors to psychological, emotional, spiritual and cultural factors. And in treating someone, it's extremely important to really have a view of all of these factors and interplay of these important points about each patient. And for us to be able to design a collaborative approach with the patient and other key stakeholders involved, addressing all of these areas in order to be able to put forward a realistic treatment plan or management plan that allows the patient to get the best outcome. And I think that has to be the most important thing. Culture can be viewed as a multi-layered presentation itself, that culture could be where you're born, culture could be the way your family perceives illness, and what you understand about wellness, about health, about what symptoms mean and what illness means. It's the particular groups that you could be belonging to. It could be anything from your political views to the particular town or city or country you're living, to particular subcultures of professions that you belong to. And a lot of those things really we're finding that have a factor in how the person will perceive their illness, what it means to them, and that can have a huge impact on the person actually first of all seeking help or not seeking help, depending on whether they think that this is something that a medical profession can help, or their the religious leader can help, or their family can help with. And their perception of the treatment that we give them, whether they believe in what we give them in Western medicine versus, for example, traditional medicine. And if we truly want to engage people in treatment, especially in mental illness, which is extremely important to have that rapport with the patient, it's very important for us to understand the context that person understands their illness and the treatment that we're offering them. Otherwise, compliance would be a huge issue for the patient.
Hi, I'm Leslie Braun. I work at the Alfred Hospital. I work in the Department of Surgery, in the Cardiothoracic Surgical Research Unit, and also in the Pharmacy Department. I do different types of research projects, as well as setting up, together with Professor Frank Rosenfeld, the Integrative Cardiac Wellness Program. I've been there for about 3 years, and it's been a fantastic experience. Professor Rosenfeld's done a lot of research on coenzyme Q10 and its work in cardiac surgery patients. And so what we've been really doing is extending that out and developing a program and adding to that, so that the experience of cardiothoracic patients is going to be improved. So they have better outcomes, less complications, better quality of life, better pain control, by using things like natural supplements, massage therapy, stress reduction, and different things like that. So it's been very good, very interesting. We've got a number of research projects up and running at the moment. At the moment we've got a phase 4 project, which is the Integrative Cardiac Wellness Program. So everyone at the Alfred Hospital who's an elective patient who comes in for bypass surgery or valve surgery is given some supplements that contain coenzyme Q10, alpha-lipoic acid, magnesium and fish oils, and we set them up taking that at the pre-admission clinic before surgery. So by the time they get admitted for surgery, they've been taking that for a number of weeks, and it's stocked up their levels in their body. And then afterwards we get them to take it for another 4 weeks after surgery. So they take it into the hospital, they take it on the ward, and when they get discharged they continue. And what we've found is, based on a randomised study Professor Rosenfeld has already done, reduction in atrial fibrillation, length of stay, as well as less heart damage in the surgery. So we're rolling that out as standard now and just confirming those results. And that's been really good. Everyone is interested in doing that. I think we've only had one patient in the last 2 years who said they didn't want to be part of that, so a lot of patient interest. Just about to finish a stress reduction study on the ward, where we've randomised people to either receive a massage or quiet time, and we're looking to see whether massage can reduce pain, anxiety, muscle tension in these types of patients, and also how feasible is it to deliver a massage on a busy cardiac ward. Are the nurses happy for it to happen? Are the massage therapists happy for it to happen? Have there been any obstacles that we need to deal with? So all of those issues, and we're nearly finished. We've recruited 195 patients so far, and we're feeling really good about that. We're getting great feedback. Even the physiotherapists are referring patients to us now, so that's been great. Well, I think that there's a few things. I think that when people go through major surgery, there's quite a lot of anxiety and fear about that whole process. And so I think massage might touch them on an emotional level as well as a physical level. In a hospital which is very busy, most people only get touched if they're taking a blood pressure or a blood sample or that type of thing. So actually to be touched where you're not hurting anyone, you're actually giving them something that's pleasurable and relaxing, I think is also really nice. I also think that hospitals can be quite unfriendly places to a lot of people. So this is really bringing in a little bit more of that compassion, I think, that some hospitals are missing because they're very busy places. So I think the massage is really addressing a number of different issues, psychological, emotional, as well as physical for the patients. And so they're really enjoying it, which is good.